welcome back to Pocketbook Pediatrics. I'm Dr. Richland Brown, and as usual, I'm always so happy to have you here with me today. Not quite as usual, we're in a little bit of a different place, but I don't know how it is where you are, but here in Jamaica, we're quite hot, so we had to find a little bit of a cooler spot to have our conversations with you. And of course, I'm keeping well hydrated. I hope that you are too. You're making sure that you and your little ones are getting enough to drink and staying in on those hotter summer days, because it really is important to keep ourselves safe in this very, very hot weather. But different place, but same old Pocketbook Pediatrics, so let's talk. Now, the last time we were together, we spoke a little bit about different types of hygiene to keep us well, particularly hand hygiene and cough etiquette, but there's also another type of hygiene that's very, very important to talk about as well, and that is your oral hygiene or good mouth care. And that's because we've found that dental care or dental problems have been one of the greater burdens in pediatrics over the last couple of decades. And this is particularly with respect to things like cavities, or you might hear your pediatrician or your dental hygienist say dental caries, right? So it's important for us to talk about how to keep the mouth clean and the prevention of us getting these cavities in the mouth. Now, when we talk about having cavities, we have to think about how cavities are formed in the first place. And it really has a lot to do with what we eat and the bacteria that's already in our mouths. So bacteria, they thrive on sugars, different types of sugars. And the sugar that is in our mouth and lying on our teeth, our tongues, our cheeks, the bacteria begin to break these down for their use and their energy. And as they break them down, particularly on the teeth, they can also break down that hard surface of the teeth, or what is called the enamel, and cause holes in the teeth. And that's what you mean when we get cavities. And if we don't address these, they can get bigger and worse and cause severe problems. So it's important to address them. But when we talk about sugar, you might be thinking about things like table sugar or things that are found in candy, cakes, sweets, chocolates. But you might not be thinking about other types of foods that sugar can be found in as well. And that is things like bread, chips, snacks, even breast milk and formula. And that's because when we say sugar, we're really talking about how food is broken down into simple sugars that we use for energy and the bacteria use for energy as well, and that will lie around in the mouth from the different things that we eat. So how do we keep the mouth healthy? Your baby really needs good baby teeth to have good adult teeth, and so the care of the mouth is really going to begin from infancy, and as a matter of fact is going to begin even before the eruption of that first tooth. And so good mouth care starts at birth. It starts with wiping out the mouth with a clean, wet rag twice a day, after the first feed in the morning and the last feed in the night, and that will continue until your baby begins to have their first tooth. Now, you wipe all the surfaces of the mouth, you wipe the gums, the cheek, the tongue, and that should be fine, and it gets your baby into that habit of knowing, oh, my mouth should be cleaned twice a day. Now, once that first tooth comes up, which is about at the 6-month marker, then you can begin to use a fluoride containing toothpaste. But the amount of toothpaste is going to be what is very important as your baby grows. So for 6 months to 3 years old, a smear of toothpaste is what is going to be appropriate, so that they don't get too much fluoride in their systems, and just enough to keep those teeth and mouth clean. Now, from 3 years to 6 years, the amount of that toothpaste is going to increase to about the size of a pea, and that should be enough to keep your child's teeth and mouth clean. We definitely want to be teaching them to spit and not to swallow, so that they don't ingest too much fluoride, which can cause another problem called fluorosis, which can sometimes just be cosmetic, causing some white spots in the teeth, but sometimes it can be a little bit more serious than that. So we just want to make sure that we're teaching them that it's not a good idea to swallow the toothpaste. Now, we also want to teach them that they need to be brushing for 2 minutes And that can be broken down into 4 30-second portions to be sure that we're getting the 4 corners of the mouth. So right, top and bottom, left, top and bottom. And we want to make sure we're brushing in a circular motion, all the different surfaces of the teeth, front, back, top and bottom, and making it a fun time for them as well. Some toothbrushes have a timer. Sometimes you can get a little egg timer. Again, songs are always my favorite, but teaching them to get to that 2-minute marker. Now, from 6 years onward, we still want to make sure that we're supervising our children brushing their teeth and helping them as they need to, and making sure that we're getting some flossing in as well. Once your children's teeth begin to touch, it's okay to begin to start flossing. Even from the toddler stages, it's okay to begin to start flossing and then teaching them to floss for themselves. Now, we also need to talk about what are some of the risks for having cavities. And that would include definitely those sugary drinks and candy and cakes and things that have a very high sugar content, but also things like the use of a sippy cup, and particularly using the sippy cup throughout the course of the day. So they're having some kind of sugary beverage in between their meals and continuing throughout the day. It's very good to teach your children to have their juice with their meal rather than in between meals. So that will reduce the amount of time that their teeth are exposed to this high content of sugar throughout the course of the day. Other things include things like giving a bottle at bedtime, or even falling asleep with the breast in the mouth at bedtime. And that's because it takes away from your ability to do that evening brush or that evening wipe and get those teeth clean before they fall off to bed. So it's good not to teach your children to have that habit of falling asleep with a bottle or falling asleep on the breast. Having a smoker in the house also increases the risk of cavities. And we also recognize that children with special needs sometimes have a greater difficulty with their oral health care. And so it's important to get them to a dentist early as well. And as we talk about dentists, when is it the right time to introduce the dentist? So your dentist will be happy to see you from the eruption of that very first tooth. But if not at the first tooth, at least by the first birthday is what is recommended for that first dental visit. And from that first visit until they're 3 years old, it's recommended that you go every 6 months. And from 3 years onward, every 6 months is preferable, but if you can't get to the dentist every 6 months, at least once a year, so that it can make sure that everything inside that little mouth is going okay. And if there are cavities, that they can catch them early and do something before they become a very big problem. What are some of the ways that we can prevent cavities from happening in our children's mouths? Of course, we're going to have that brushing going on morning and evening. We're going to reduce the exposure to those sugary drinks and cakes and candies, but also again, good eating habits. Teaching your child to drink out of a cup rather than a sippy cup, and teaching your child to have their juice with their meal rather than throughout the course of the day. There's one last thing we have to talk about, and that is the use of glycerin. Now, it's something that's practiced here where grandma will pass it down and it goes down through generations, that glycerin is good to use to clean your baby's mouth. I don't know what it might be like where you are. You can tell me in the comments if you have something different or if this is something grandma suggested for you as well where you live. But it's definitely something that happens here in Jamaica. But while glycerin is not a toxic substance to your baby, it also is not one that is recommended for the use of oral hygiene by any pediatrician or by the dental hygienists or dental health professionals either. What is recommended is really what we've spoken about already. So cleaning that mouth up with water before they have the first tooth, and then the use of a fluoride containing toothpaste after that tooth comes up and onward. So that's it for Pocketbook Pediatrics today. I hope that you understand a little bit more about mouth care, how cavities are formed, and really the what, when, and how of keeping that little mouth clean from the eruption of that first tooth and giving them healthy teeth throughout the course of their lives. Thank you so much for watching, and I really look forward to seeing you the next time on Pocket with Pediatrics. God bless.